what was the outcome of the work that has been carried out by the Council of Europe. So just a quick reminder, the Council of Europe is composed of 47 member states, even though it's at European level, which include the 28 EU member states, but not limited to that. And what is on the screen is actually some of the most relevant instruments which were adopted. The first two are legally binding and are presented in this orange booklet. I just want to say that there's no color code with the orange, so the light is completely green for you to take a sample of that booklet, which is on the table there. And the two other instruments are non-legally binding instruments, but they are also quite relevant in the context of these discussions. And as you might see from these slides, the first recommendations is actually under re-examinations, and for your information, there will be most probably a public consultation on the revised draft of these recommendations, which will focus on biobanking. So what I'm going to say in this only slide that I have actually for my presentation is just to highlight what are the key issues which resulted from these discussions which lead to the adoption of these legal instruments. And I'm afraid I'm going to reiterate a lot of things that have been said this morning. If you see on my slides, some titles are underlined, others are not. And the reason to underline is when there are already provisions that have been adopted addressing those issues, sometimes as a form of principle, as you pointed out this morning. When it's not underlined at the governance and biobanks, for example, it's because it's under considerations and we are developing these discussions. So my first point is about information and support. I think there was a lot of emphasis on the importance of that information and support this morning already. And this was also something which was highlighted very much in the discussion and leads to adoption of legal provisions. Both in research and in healthcare or clinical settings. I think this is extremely important to have a global approach to that. And both at the level of the general public. That is important to build trust. That is important that people have access to objective information on what is the reality and what are the promises or the expectations, but also the limits. And the limits may be evolving also, as well as the expectations as well. But I think it is very important, that was a strong point in the protocol, that the public in general have that information available to be able also to empower themselves. I know 23andMe, for example, advertised about empowerment, but I think that this is even more important empowerment, to be able to have a critical eye on it. It's probably the most challenging exercise because teaching uncertainties is extremely complicated, and it's much more simple to have binary information. So it is a huge challenge, but it's also to be expected as an important result to build trust and adhesion to the whole problematic of genomics. And I would personally argue that it should start in secondary school already, but that's my personal view on this. I think this is extremely important. It's also important at individual level, and there was a reference to informed consent this morning, and I fully agree with the idea of consent as a process. And I think that having appropriate information to individuals for them to be able to make a decision is actually the main issue in the consent process. I just want to open a bracket because I noticed that in several presentations there was reference to presumed consent as an alternative, broad consent. But we're not talking about the same things. When you're talking about presumed consent, you're talking about a form of consent. When you're talking about broad consent, you're talking about the scope of that consent. And I think the key issue is the information you provide. And I would say, in practice, what we see often is that when there is a presumed consent, there is no information. And this is what is the main concern. I close the brackets. We may come back on this during the discussions. And the counseling is also extremely important. There is a continuity of support when you bring the information and you help the persons to cope with the result. I think it's even more important when you're talking about whole genome sequencing. And that step is really key in this process. Also, when it comes to individual information, because you have a blurring area between clinical and research, and it will be even more important to provide information on that at the time you are in front of the person rather than afterwards. And second, because unexpected findings is a growing certainty, if I can play with words. And it is extremely important to have this dynamic exchange and information in this context. Now, goes hand in hand with that the possibility to provide that information. So to have people who are equipped and trained to be able to provide this service and to have appropriate genetic services. The challenge is even more important with whole genome sequencing. I would argue more into the clinical area than in the research area, actually. Because in the clinical context, people tend to see so far patients, so people with symptoms or with a family history of disease. Now, if the idea is that through the information you gain from the whole genome sequence, you are actually coming to see the doctors when you are not patients, so to say, like you don't have any symptoms, it's a new job that the professional has to do. And to have a proper training and education on this is extremely important. So it works both for the public in general, but the professionals as well. Now, privacy. Well, it's a general term. It covers many different aspects. It was said this morning that there is no more privacy. Well, I would argue that this is not completely true. Maybe it's a different way of thinking privacy. I think Alastair this morning talked about control, and I think this is what privacy is now. My question is, at which level? Is it a control on an individual level, or is it like deciding for a state that it's only limiting access to this pool of data they've been collecting? And I think this is an important issue. Anonymization is not cannot be guaranteed anymore. Third-party access, we discussed that this morning, employment and insurance, is certainly an issue to be looked into. It's very important. It is, I would argue that it's important also because you may have situations where people are actually refusing to use genetics, which could actually be beneficial on individual and global level, by being afraid of this information being used or misused by third parties. So I think this is important to address that. And also the trans-border flow of data and the level of protections between countries is also another important issue, I would say. And we are at the Council of Europe currently, it's underlined, but it's also under discussions, and we will probably collaborate, the Committee on Bioethics and the Committee on Data Protections wants to have a closer look to health-related data issue on this, to re-examine former legal instruments in the matter. Now, governance, well, it's the whole subject, but I think that when it comes to biobank, it's something that is quite new development. It goes with the dimension of the biobanking activities, and it is also important then to build trust in that. So, feedback policy, information, management of privacy, all these aspects needs to be looked into in the biobank context. And there are examples already in certain countries of initiatives that have been taken. I think we could learn a lot from this, but it needs to be really thought through. Again, because as was acknowledged, research and progress needs to have access to data, needs materials to do this research, and you need to get partnership between the people who will actually provide that information, or ourselves, because well, we are the public in general, so we may give our samples to biobanking. Also building trust, because most data are coming from the clinical setting, and here again, you need to be transparent. When you go to the hospital, you should not fear that this sample is used without you knowing it for research purpose. That's very important. So all these aspects has to be thought through. Also, with regard to the trust and partnership with the patient and with the public in general and people in general. Clinical utility, and I just want to note that it was absent from the draft regulations on in vitro medical diagnostics, but now it has been introduced following the discussion with the European Parliament, I understand. So I think this is important. At least this was a key issue in the discussion at the Council of Europe and in the protocol, as clinical utility was considered to be an essential criteria when offering a test to a person. And clinical utility, and I know that there was some work which say, well, we should go from clinical utility to personal utility. But I do think that clinical utility includes a personal dimension. You have the clinical utility attached to a test in absolute value, but there is also the situation of a person which make that clinical utility different possibly. If you are 60, procreation choices may actually be different than if you are 30 or 20. And so the clinical utility aspect is also in the light of the particular situation of the person's consent. I also think that clinical utility is extremely important when it comes to newborn testing. And here it's the time notion that is important. And one of the principles of the protocol is to say that you should postpone testing on children until they are able to consent, except if there is a clear benefit during childhood for the child. So, for example, if you would know genetic biomarker for a degenerative disease that could develop later on in life, and there's nothing you can do actually before 40 or 30, what's the point of having that information? Because the child will have to live with that. This information is there. It will be so-called close future. Some people have a kind of very drastic way of talking about open or closed future when you have access to that information. Well, you're not able to decide really, but I think this is an issue to be considered in terms of talking about clinical utility. Now, the last point is evaluation of assessment. This is certainly true when it comes to clinical utility, this was said before. But I also think that assessment is important because independently of all these principles that are listed here, assessment enables also to see how implementing them in developing policies. So you have to go through the whole series of principles there in the light of that. So assessment enables to identify the key criteria, but also to identify way to implement the principles that have been agreed. Possibly sometimes differently from one country to another or from population to another. But this is certainly a key issue. Also, not only for the protection of human rights, but I think protection of human rights goes hand in hand with progress for human rights and progress for health. So we are all benefiting from that. Thank you very much.